Hi, Miss B. How you doing today?
Right, fine, thank you.
My name is Richard Johnston. I am a physical therapy assistant student at Professional Skills Institute, and I am going to be working with you today to get you moving for treatment. And what is your last name, just for verification purposes?
It's B.
And then what is your date of birth?
May 18th, 1950.
Sounds good. All right, so I think it's okay that we stay here today. I talked to your husband and your three daughters. Actually, we have your husband right here. Hi, Mr. B. Good to see you. He's just gonna sit here and watch so that he sort of knows what's going on, because I know you have a goal to get moving again so that we can get you back home. I know you need, so I understand she needs a little bit of help when it comes to lying to sitting and sitting to standing, but not too much, which is good. Most of it you can do yourself. I know you had a recent bypass surgery, so we'll constantly be checking your vitals. And if you get tired or fatigued, let me know, okay? And then we can slow down a little bit.
I've been having some dizzy spells lately, too.
Okay, yeah. We have to be aware of your right side stroke. So I'm sure you know we don't have that much movement on the left side, so we want to get you moving a little on the left side of your body. One of the main things with a right CVA is that patients with right CVAs can be very impulsive, so it's very important that we take our time when we do the treatment. Don't try to get ahead of yourself with treatment. Just make sure we got to make sure we're performing each exercise individually, and we are going to do them over and over again. We're going to be very repetitive so that they sort of get ingrained in our head. And I'm going to give lots of directions, lots of cues. We're going to make sure we don't pull on that shoulder because we know it's sublux, so we want that shoulder to heal a little bit. And we're going to do something called blocked practice, where we perform small increments of getting from laying down to her side. We don't want to just get you straight from laying to sitting. We need to put it in little segments, all right? So what we're going to do first is what's called the serratus anterior punch. So what I'm going to do, Miss B, is I'm going to come right here, and then what I want you to do, what we're going to do is we're going to work on your shoulder muscles. So what I want you to do, the motion I want you to do is just like this. So I'm going to hold up your arm, just relax. And what I want you to do is just come up really slowly, just punching from that shoulder like you're punching. Good. 1, 2. Let's slow down a bit. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. Okay, and now this time, can you punch over, just punch a little over my shoulder to the left or to the right? So let's try it again. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. Okay. Now this time, I'm going to count to 3, and I want you to punch as hard as you can, to swing that arm, I want you to propel that shoulder forward as far as you can over my shoulder, and then you're going to lift yourself up, and then you're going to lift your butt up as much as you can and turn to your side, and then we're going to get you to a sitting position, all right? Can you do that?
I'll see.
I believe in you. Ready, Miss B? All right.
Yeah.
So 1, 2, 3. Good. Good, good. Good. All right, let's get you back down. All right. Okay, so now what we're going to do is D1 lower extremity flexion with rhythmic initiation. So what we're going to do is, I know you can lift up your leg a little. Can you go ahead and do that for me? Lift up your left leg just a little. Good. Good. That's actually really good. You can put it back down. What we want to do is we want you to be able to cross this leg over your good leg. The reason for that is it'll help you with rolling over, because when you roll over and you leave this leg over here, when you think about it, you're leaving a lot of your weight on this side, and it's hard for you to really propel yourself up on your side and sit down if most of your weight from the side of the body is still over here. So when you cross your leg there, you've already done a good bit of the work, and your leg's already where it needs to be when you turn. So what I want you to do at first is I want you to just relax and let me move you, okay?
I'm so relaxed I could go to sleep.
Don't go to sleep yet. It's not nap time yet. All right. 1, 2, 3. Let me move you. 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now I want you to move with me. 1, 2, 3. Very slowly. Good. 1, 2, 3. Good. 1, 2, 3. Good. 1, 2, 3. Good. We don't want to go too high. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. Now, do you think you could do that motion on your own?
Oh, well,
Do it
we
very
can find
slow.
out.
Do it very slowly. You're progressing well. All right. I'll count 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. One more. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. All right, go ahead and rest. Check your heart rate. Okay. Looks like your heart rate's beating normally, so that's good. How you feeling? Like $1,000,000, right? Good. So now we're going to do this one more time, and I'm just going to add a little bit of resistance. So I want you to push through the pressure. Don't let me push you back, all right? So we'll go ahead and start now, and go ahead and push. Make that movement. Push, push. Good, good, good. Back. Push, 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 push. All right, again. Push, 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 push. Back. Push, 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 push. One more time. Push, 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 push. Good. Push, 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 push. All right. Looking good. I think you're ready to run a few miles, aren't you?
A marathon.
Sounds good. The last thing we're going to do is called upper extremity dynamic reversal for the reverse chop. So what we're going to do is I am going to have you clasp your hands, and what I want you to do is I want you to put the thumb from your bad side over on top. So just like that. That's good. And what we're going to do, kind of similar to what we were doing with your leg, only we're going to do it with your arm, is sort of like a seat belt. We're going to bring your arm, try to do as much work with this side as you can, but you can pull with your good arm too as you go up. What we're going to do, very gently, we're just going to bring your arm up to your shoulder like that, like you're grabbing your seat belt, and then back down. Again. Bring it up, 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 just like that, and bring it down. Now the reason we're doing this, so bring it up, 1, 2, 3, if you'll see right here, when you're rolling over to your side, you want this arm cleared so that you can easily push yourself up when you're on the sideline position, so that you can use your good side to push yourself up. Plus, as you see, you already got your weight, most of your weight from your upper extremity sort of cleared on this side so that it's not holding you back on your bad side. All right, so let's go back. Can you do that motion a few more times? 1, 2, 3, 4, 5. Come right here. All right, and back. 1, 2, 3, 4, 5. Let's do that a few more times. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. All right. Now relax. How you feeling?
Tired.
Now let me check your heart rate. Looks like you're still doing okay. So what we're going to do is we're going to do that again. This time I want you to turn your head with the movement of your arm. So look over here. What you're going to do is you're going to go up and turn your head at the same time, and then back down. Turn your head up, and then back down. Okay? Can you do that? Here we go. Good. Yep. Left finger over, and then come up. 1, 2, 3. Turn your head. 2, 4, 5. Good. Now back down. 1, 2, 3, 4, 5. Do it again. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. All right. Now, I'm going to get you in a sitting position. So we're going to use that to get you in a sitting position. So do you remember what I said about your lower legs? I want you to cross, very slowly cross your legs across this one. Can you do that for me? Good, 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 good. Just like there. All right. Now I want you to get that clasped hand position. And this time, I want you to, when I count to 3, I want you to do it really fast. Take it over your shoulder, turn your head, and then I'm going to sit you up, and then I want you to push yourself up with this arm when you get it right here, and then we're going to put you in a seated position, all right? Ready? 1 second. All right, count to 3. 1, 2, 3. Good. Up, up, up. Good. All right, and then sit straight up. And then let's uncross your legs. Move your hips over a little. And then straight posture. Good. So how you feeling so far, Miss B? Doing okay? Doing okay, Mr. B?
Just a little dizzy.
Okay. You feeling dizzy? You need to rest a little?
A little.
Okay, you need some water?
Maybe a little.
All right. Some new water for you. Here we go. Great. Feeling a little better? Think we can keep going? All right, we just got probably about 5 more minutes, all right? Sounds good. That was not planned. All right, so now we're gonna work on your left shoulder. I know you got some plasticity there. Some plasticity, so I know that it's your left shoulder is extremely stable. I know you got some pain there, so we want to increase that stability in your shoulder so that you can activate those muscles in the shoulder and you're able to, grab things when you need to, and your shoulder's not just laying on the side there and doing your own thing, all right? So what we're gonna do first is rhythmic stabilization to the left shoulder, with your arms sort of crossed. So what I want you to do first is I want you to cross your arms a little. You can, with your good side, hold your arm up just a little, and I want you to see if you can bring them up just a little, just like that. Okay, well first, actually, let's go back down. Let's get back to that straight posture. Can you do that? Do you think you could scoot your hips back a little? All right, here, lean this way, and then scoot back, and lean this way, and scoot back. Good. All right, now hold that up again, and try to get that straight posture if you can, all right? And what I'm gonna do is, don't let me push your shoulder here, okay? I'm gonna give you some slight pressure. Don't let me move you. Ready? Hold, hold, hold. Good. Don't let me move you. Good. Don't let me twist 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 you. Good. More time. Don't let me twist you. Good. Don't let me twist you. Good. All right, so relax. You feeling okay? Good. Check your heart rate. All right, so what's important about that is that's going to improve your shoulder ability to resist opposing forces and just overall improve your stability, not just in your left shoulder, but both your shoulders. So as you see, you were able to activate those muscles without even moving them. So, but you seem to tolerate that well, so let's see if we can make it a little harder, all right? Sounds good? All right. For now, we are going to do a stabilizing reversal of your arm. So we're going to bring your arm up here. We won't do that yet so that we don't. This is going to more so isolate the muscles in your left shoulder and further improve and further challenge the muscles in that left shoulder and improve motor control of the shoulder. So what I want you to do is bring your arm up, and then I want you to hold it up just like that. Still have this left, yep, good, you remember, good job. And you're gonna hold it up.
The only things I remember.
We're gonna do this really quick, because I don't want you to keep your arms held up forever, because I know that could tire you out. I'm just gonna apply some pressure to your shoulder, and don't let me push you, all right? Don't let me push you. Good. 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 Don't let me push you. Okay, relax. Feeling okay?
Yeah.
All right, let's do one more. Can you get back to that position? So just like this. There we go. And then I want this thumb on top. Or nope. No, you're right. You got it, Miss B. That's your left thumb on top. Good. Now I'm going to do up, down. Don't let me push you. Good. Don't let me push you. Good. Don't let me move 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 you. Okay, relax. You feeling okay? Need some water again, or are you okay? One more thing we want to work on, and that's your trunk. So really quick, are you able to kind of rotate your trunk at all? Can you try doing that for me? Yeah, you're a little stiff down there, aren't you?
A little?
Well, that's okay. What we want to do, you can stop. We want to improve movement in your trunk. This will help you with turning your body when you do transfers, when you get up out of bed, and then it'll also help you reach for stuff. When you need to reach for stuff, because when you think about it, you have a lot of trunk control when you're reaching for things. and it'll make you more independent in that sense. So I'm going to get you back to a lame position. So go ahead and lay to your side. Good, good, good. And straighten yourself out. What's that doing there? All right. And here, let's fix your head. Good, good, good. And now what I am going to do is here. Rotate your trunk a little more. Count of 3. 1, 2, 3. Good. And I'm going to get your feet up so that your knees are bent. So just relax. Good. Good. And now what we're going to do is I'm just going to move your legs back and forth. Just let me move you. Just relax and let me move you. Let me move you. Let me move you. Feel your trunk moving down there, your waist. There is movement. There is movement down there.
A little bit.
Here, let's bend up a little more. All right. Now this time I want you to move with me. Move with me. Good. 1, 2, 3, 4, 5. Move with me. 1, 2, 3, 4, 5. Move with me. 1, 2, 3, 4, 5. Move with me. 2, 3, 4, 5. All right. Now, can you do that on your own?
I'm gonna try.
All right. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. Go a little further, a little further. Good. All right. Now come back. 1, 2, 3, 4, 5. All right. So now you feeling okay?
Yeah.
All right. We're going to do that again, and I'm going to give you a little bit of resistance. So I want you to push through my pressure, okay? So come towards me first. Push through. Good, good, good. Okay, now push through. Push, 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 push. Good. Push, push through. Push, 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 push. Good. Now push through my arms. Push, 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 push. All right, good. Now go ahead and let's get your feet flat again. And then let's get you back to sitting again. So do you remember, let's see if you remember. Let's, you want to do that one? Okay, we'll do that one. And over that. And then on the count of 3, do you remember what you do with your head?
Move it.
Yep, turn it towards me. Remember what you do with your leg?
One over
Yep,
the
just
other.
cross it. All right, and on the count of 3, we're going to transfer over again. 1, 2, 3. Good. Up, 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 up. Good. And let's fix your posture. Or here, let's fix your legs first. And then fix your posture. See if you can sit straight up. Good. All right, so now we are going to, your trunk is improving quite a bit. Let's get your legs straight. So we're going to do a few more exercises to challenge those trunk muscles, all right? So what I want you to do, I have these water bottles. And what I want you to do is I want you to grab these and I want you to twist your trunk, use both your arms, both your hands to grab these and I want you to lay them on this table. Can you do that?
I guess. You're the balls.
All right. So go ahead and do that. And I want you to concentrate on your trunk. Use both your hands, all right? You grab it with your other hand too? Good. I want you to twist with your trunk, all right? Good. Feeling okay? Feeling dizzy?
Ow.
Let me check your body. All right. Okay. Got 3 more. I'm going to challenge you a little on these last 2, okay? Over here. Good. Oh, party foul. That's okay. Good job. Miss B, we are done for the day. I'll get you back to laying down and we'll get Oprah back on for you.
Probably Andy
or
Griffith
no, I think
show.
The Price is Right is on now. We'll watch Price is Right. How about that?
I want the Andy Griffith show.
We'll do Andy Griffin, all right?
Good.
All right, so let's get you back to laying down, or do you want to stay seated? Let's get you back to laying. Get you some rest, all right? Here we go. Lift your head. Like that. And lift your head. There we go. All right. Okay, and then Mr. B, the reason I had you here too is because I wanted to sort of educate, I want you to sort of see the process of everything so that when she does get discharged and she goes home, you can sort of know what to do and how to sort of ways that you can assist when she needs help getting up. So the patient response is, functionally, your wife is doing great. Your transfers and ambulation were already, and walking were already, she needed very minimal assistance prior to treatment, and I don't think it should be too long before she's much more independent. Your carryover is fair due to, just some of those cognitive deficits and visual deficits on the left side. We, as you saw, and this is something that you'll need to do at home too, is we had to use a lot of verbal cues. A lot of times we had to do some counting, which really helped. We had to do a lot of verbal cues, a lot of audio cues, just to combat those cognitive deficits. Safety awareness is pretty poor. With the right side CVA, patients are typically very impulsive, so we need concise and specific directions numerous times with numerous verbal cues. Some modifications that we can always do, might be good to get a pulse oximeter at home so you can constantly check her blood pressure and her heart rate and her blood saturation level, so you'll know when to sort of give rest her exercises. Due to her bypass surgery and her embolism history, I think it's very important to constantly check her vitals. If she is having excessive episodes of, just if she's having a bad day of lability, of depression, on certain days, then treatment can always be toned down those days. You can also experiment with different kinds of verbal and audio cues to see which works best. I did a lot of counting, as you saw. You could try snapping, or you can even do music, try to do it to the beat of music. And also ensure that you're always standing on her right side close to her head due to her, because that's sort of the best way to guard her. And make sure you're always You're never pulling on her arm. You're always grabbing under her scapula, down here under her shoulder blades, whenever you're pulling her up and helping assist her. So outcomes, she should demonstrate continued improvement with movement, given how she was already needed very little assistance with most transfers. Fortunately, there's always going to be some sensory deficits due to damage to the thalamus area of the brain. So it's important that you're constantly, repeating these movements over and over again so that they become ingrained into her, and that you're constantly giving her verbal cues. So that's it.